You know, in medicine, you'd think the deadliest mistakes would be big and dramatic. But a lot of the time, they don't shout, they whisper. And that's never more true than when you're looking at an electrocardiogram, an ECG. We're going to dive into some of these super subtle patterns that, if you miss them, can be absolutely fatal. So let's get right into it.
Okay, so this sounds completely backward, right? I mean, the normal one is the dangerous one, but trust me, this one idea is the key to unlocking some of the absolute worst errors in emergency medicine. So, how on earth can normal be the most dangerous thing you see? Well, let's find out.
All right, let's start here with this idea of the whispering ECG. Why can a normal reading be a huge red flag? Well, it's because the deadliest mistakes aren't when you're looking at some crazy, chaotic ECG. Nope, they happen with the super subtle ones, the ones that get mislabeled as normal. And that lulls you into this false sense of security, all while a total disaster is just waiting to happen.
Okay, so now we're going to get into the really tricky stuff, the hidden patterns and what I like to call the doppelgangers. These are the situations where some of the most dangerous heart problems disguise themselves as something totally harmless. It's like a killer hiding in plain sight.
Let's kick things off with our first case, the mirror image heart attack. This is what's technically called a posterior STEMI. Now, a STEMI is the big one, a really serious heart attack where an artery is totally blocked. But this one is extra sneaky. Why? Because it hides from the standard ECG. It's happening on the back of the heart, which is basically a blind spot for the machine.
And this is where the trap is sprung. You look at the ECG, and what you see is often just called nonspecific ST depression. It's just this little downward dip in the line. Seems minor, right? But what's really going on is a life-threatening heart attack on the back of the heart. And because it's on the back, the ECG machine sees it backwards, like a mirror image. So the signals that should be shooting up look like they're going down.
So what's the big takeaway here? It's a really powerful rule of thumb. If you see that horizontal ST depression in those specific leads, V1 through V3, your alarm bell should be ringing. You've got to immediately think, could this be a hidden posterior heart attack? You can't wait for it to jump out at you. You have to actively hunt for it.
All right, next up is a classic doppelganger. This is the perfect example of something deadly putting on a costume, pretending to be a totally normal, harmless condition.
And this is just a perfect illustration of a cognitive trap. So there's this thing called benign early repolarization, and it's a totally normal pattern you see all the time, especially in young, healthy people. No big deal. But when you see that exact same pattern in, say, a 50-year-old who's clutching their chest in pain, it's not benign anymore. Not at all. It's a disguise for a subtle but very deadly anterior heart attack.
And the rule here is just, it's so powerful, and honestly, it applies way beyond medicine. Context is everything. The pattern on the ECG is meaningless without the patient's story. If the story sounds like a heart attack, you treat the ECG like it's a heart attack. The context is just as important, maybe even more important, than the little squiggles on the paper.
So, okay, we've just looked at a couple of the deadliest technical mistakes. But here's the thing. Most of the really critical errors, the ones that cost lives, they're not about missing a pattern. They're about how we think. It's not about what's in the textbook. It's about what's happening in your head. Let's dive into these cognitive errors. And boom, there it is. The most dangerous mistake isn't technical, it's cognitive. The real enemy here isn't a lack of knowledge. It's a glitch in our thinking process, especially when we're under a ton of pressure.
And these are some of the classic traps. They're basically mental shortcuts our brains love to take, but they can lead to total disaster when the stakes are high. Things like anchoring bias, where you get stuck on the first piece of info you hear, or premature closure. You jump to a conclusion way too fast. And a big one is just relying too much on some rigid checklist without actually thinking. These are the real killers. I love this quote because it just nails the whole idea. The ECG is a snapshot. The patient is the movie. An ECG is just one single frame. If you try to interpret that one frame without knowing the whole story, the whole movie, you're setting yourself up for failure. You gotta watch the movie.
Okay, so if the problem is how we think, then what's the solution? Well, the best clinicians, the experts, they build a framework for safety. It's a system designed to force them to slow down, to step back, and to actually listen for those whispers. And the solution, it's not some kind of magic trick. It's discipline. It's having a systematic checklist you follow every single time.
It forces you to go through the motions, analyze the rate and rhythm, look for the key warning signs, and actively search for those reciprocal changes. Remember the mirror image clues we talked about? And then you always compare it to an old ECG if you have one. But the most important step, the last one, is to stop and ask, does this actually fit the patient's story?
Now, here's a really profound idea, and it's for anyone who makes high-stakes decisions. You know that feeling in your gut when something just feels off? Like the pieces of the puzzle don't quite fit, but you can't exactly say why? That feeling of discomfort, that is a diagnostic tool. You have to learn to trust it. It's your brain's way of telling you to hit the brakes and take another look.
And that really brings us right back to where we started. The ECG almost never lies. The clues are right there on the paper. The problem is, they aren't screaming at you. They're whispering, and they're just waiting for someone to lean in close and actually listen.
So at the end of the day, this isn't really just about reading an ECG, is it? It's about a deeper kind of attention. It's about fighting the urge to take the easy answer, about respecting the whole story, not just the snapshot. It's about realizing that in almost any complex situation, the most critical signals are usually the quietest ones. Which leaves us with the pretty big question. In whatever we do, are we listening closely enough?